he leads the Secretariat for Great Apes Survival Partnership, which is an alliance of different member nations, research institutions, and conservation organizations. He is part of GRASP since 2006, and it's located in Nairobi in Kenya or integrated into UNEP. And I think it's not the first time that he encountered monkeys, apes, or primates in his work, because he was the co-director of the Thai Monkey Project in Côte d'Ivoire. And he is also a member of the International Union for Conservation of Nature Primate Specialist Group, as well as the IUCN Transboundary Conservation Specialist Group. He has his background in animal ecology and has worked with natural resource management. His PhD work from 2001 received the Conservation Award from the Worldwide Fund for Nature and the Centre Suisse de Recherche Scientifique. Excuse my French, I tried. And yeah, I'm just very excited that today we found a slot that's going to talk about the biodiversity and health nexus, especially in development planning. That is also going to talk a lot about concrete examples and actions. So it's going to make it very tangible. And yeah, I'm very excited to learn more about this. And without further ado, I'm going to hand over to our today's expert, Johannes Refisch. Go ahead and everyone enjoy. Thank you.
Yeah, thank you, Anne-Christine. I would just suggest, in case the line is a bit weak or anything has to come to my attention, just interrupt me, because I cannot see everybody on the conference call. But let me maybe start with a little anecdote, and it goes many years back when I was still in research and I was working in the Thai forest, and I happened to be at camp, and I met with Fabian Leendertz, who many of you know. And yeah, we had a beer, maybe we had even 2 beers, I don't know. Don't remember anymore. But Fabian said, you know what, Johannes, you're doing really important work on habitat conversion, habitat destruction, the impact of poaching and so on. But I tell you, it's the tiny little things we don't see, and they are killing our animals. And years later, Fabian found out that our chimpanzees were dying of anthrax. And then even a few more years later, we observed a number of Ebola outbreaks and waves of Ebola outbreaks in Central Africa, and much later in Western Africa too. So Fabian was right. But we also learned over the years that the environment plays an important role in disease emergence. So I believe there's still a niche for an ecologist. And I think now we see that the climate crisis, the biodiversity loss, the health crisis, it all is connected somehow. And that leads to my topic for today's talk: bridging the gap to prevent the next pandemic, exploring the connections between large-scale development, ecological fragilization, biodiversity loss, and zoonotic disease emergence. And I want to start with a report UNEP and ILRI published in the first month of the pandemic. And I contributed to that report. And the title was Preventing the Next Pandemic, Zoonotic Diseases and How to Break the Chain of Transmission. And let's go first a little bit to the basics. So what are the characteristics of zoonotic diseases? So 60% of all emerging infectious diseases in humans are zoonotic. Viruses are the most likely type of emerging pathogens. Human-livestock interaction enhances the chances of spillover. Livestock serves as an epidemiological infection bridge between wildlife and humans. And we have a number of recent examples: COVID-19, Ebola, bird flu, SARS. They're all examples of recent zoonotic diseases. So in the report, we also identified the main drivers of zoonotic pandemic risk. And I start with the top of that graph. It's the overexploitation of wildlife, it's urbanization and industry, it's demand for animal protein, it's climate change, food supply chains, travel and transport, and agricultural intensification. So that was a technical report, and obviously we made a number of recommendations. and we came up with 10 policy response options. And I'm not going to go into all 10. In today's talk, I will focus on our third recommendation: expand scientific inquiry into the environmental dimension of zoonotic diseases. And this is very complex. So what is actually the relationship between habitat change, habitat alteration, and disease emergence? And there are a number of hypotheses, and it's complex. The first hypothesis says that disturbed habitats often favor opportunistic or generalist species that happen to be reservoirs for viruses. That's relatively easy to understand. In many cases, when we have large-scale development, we end up with agriculture, monoculture. Most of the animals we find are often rodents. And rodents are associated with more than 80 zoonotic diseases. And they can, they have a good life because the predators have, in many cases, removed. So this is one hypothesis. There's a second one, and one is not excluding the other. I have to add this. And this is called the dilution effect. So through a process called the dilution effect, more virus transmission events occur within a single species in animal communities that have low species diversity than communities that have greater species diversity. And that effect occurs because communities with more species basically dilute the transmission events by reducing the number of susceptible animals. The third hypothesis is quite complex, and it's called the coevolution effect. The coevolution effect suggests that as humans alter landscapes and former intact habitats are lost, forest fragments serve as islands harboring wildlife hosts of pathogens that undergo rapid diversification, leading to a greater probability that one of these pathogens will spill over into human populations, where they will cause new disease outbreaks. You might wonder why I go so much into detail, but these are really important considerations when you do development planning. Imagine you have a proposal for a large-scale palm oil plantation, and there's an option that the company owning that concession could potentially keep little forest patches. And just from a species diversity point of view, you would say, well, it's really important to maintain the bird diversity because they can move between the fragments. But now we're bringing the disease angle into that equation, and it's far more complex. And the fourth, and you probably have heard that many times, viral diversity is also associated with species diversity. So here I'm just simply projecting a map Allen et al. Produced in 2017. They looked at species diversity, which is obviously a lot concentrated in the tropical countries, but also human population densities and other factors. But you can see quite nicely that these areas in yellow, which are identified as hotspots of zoonotic disease emergence, those are areas which do have high species diversity. They also have a high human population density, and these are the areas on the Indian subcontinent, Southeast Asia, including parts of Indonesia, but also parts of Central West Africa and the Americas, the Caribbean. And I just want to give you a few examples. I mean, diseases are there as long as human beings are on the planet. And often we discover much, much later when diseases have emerged. And a very prominent example, obviously, is the human immunodeficiency virus, HIV infection. And it goes back to the 1920s. And there are two types, HIV-1 and HIV-2. So chimpanzees have been identified as the reservoir for HIV type 1 and Zooty That's a primarily terrestrial primate in West Africa. They are believed to be the natural reservoir for HIV type 2. And the first emergence was obviously in Kinshasa in the DR Congo. Another example from 1937 is the West Nile virus. West Nile because that's where it was found, and that's a district in Uganda. And the hosts are birds. and mosquitoes serve as disease vectors carrying the virus from infected birds to people and some mammals. And it became also quite known because it had established itself in the US since 1999. So again, an example that a lot of diseases, they start local, but then become a global threat. Let me also mention the Zika virus disease, 1947. The natural reservoir are primates, including humans. And again, Uganda was a place of emergence, and the Zika force, and that's where the name comes from. And we also remember a Zika virus outbreak in the Americas around 2015, 2016. And Ebola, first discovered in South Sudan and in the DR Congo in 1976. Natural reservoirs, most likely African foodbeds, not confirmed yet. Ebola is equally lethal to great apes and human beings. We have observed very high mortality rates in some gorilla populations in Central Africa with up to 95% mortality rate. And of course, we all remember the tragic emergence of Ebola, the Ebola fever in West Africa. 1986, mad cow disease in the UK. Then 1994, Hendra virus infection, natural reservoir, again, large fruit bats, and the host horses. But that is an infection or is a disease which pretty much has been restricted to Australia. Then 1996, avian influenza, natural reservoir, wild waterfowls, and hosts are poultry, and place of emergence, Guangdong in China. Yes, as I said, 1996. And finally, the Nipah virus, same family as the Hendra, and Nipah virus, natural reservoir are again large food beds, hosts are pigs, and place of emergence China. But also it moved beyond China. There was a large outbreak in Malaysia from 1998 to 1999, and then again in Bangladesh from 2001 to 2005. So let me just pick two of the most prominent examples. I think HIV-1 and HIV-2 are very prominent examples, and so the closest relative of the HIV-1 are Zeaman immunodeficiency viruses that infect wild-living chimpanzees and gorillas in Western Equatorial Africa. And 4 lineages of HIV-1 have arisen by independent cross-species transmissions to humans, and 1 or 2 of those transmissions may have been via gorillas. Less known is HIV-2, and here the closest relative is the Zeaman immunodeficiency virus in sooty mangabees in West Africa. And SIV-HIV species crossing seem to have occurred originally at least 6 times between sooty mangabees and humans, but there is a similarity between the two. Both sooty mangabees and chimpanzees are often kept as pets or used for food, so resulting in frequent direct contact with humans. And then let me also go back to the Ebola disease. I think I earlier said we know a lot, but there's still a lot which remains unknown. Maybe Ebola is one of the best investigated diseases because of its tragic impact. But following the early outbreaks, it was believed that Ebola is deep in the forest. Ebola comes, it kills fast, it goes to the villages, kills fast, and disappears fast. And over years, it became obvious that there were huge distances, geographic distances between the different sites or spots of outbreaks. But since 2005, we have observed that Ebola outbreaks also happen in areas outside the dense forest cover, in areas of mixed savanna and forest, or even in areas where the forest has disappeared. That applies to parts of northeastern DR Congo, for example. So that has been described, but the mechanism behind remains unknown. So I've cited a number of diseases, but now let's look at some evidence where there seems to be a relationship between habitat change and the emergence of zoonotic diseases. And one example is from the landscape fragmentation in Brazil's Atlantic forest and the re-emergence of Chaga disease caused by a parasitic protozoan Trypanosoma cruzi. And this was associated with reduced mammal diversity and increased abundance of competent reservoir species. Another example, and now we go back to the Great Ape world, from habitat disturbance in Uganda. So habitat disturbance can alter the dynamics of cross-species pathogen transmissions. When scientists examined E. coli bacteria in humans, livestock and wildlife near Kibale National Park in Uganda, they found that E. coli from humans and livestock were genetically more similar to those collected from primates living in forest fragments than the bacteria from primates living nearby in undisturbed forest areas. Similarly, in wind impenetrable forest in Uganda, also found that E. coli from gorillas with frequent human contacts were genetically similar to E. coli from people and livestock. Another example from Australia, encroachment of natural habitats brings people into greater contact with wildlife, allowing pathogens to jump from wildlife host to other species. So the re-emergence or the emergence of bat-associated viruses in Australia, including Australian bat, Lissa virus, Hendra virus, and Meningel virus linked to agriculture and urban development. And finally, land use change can facilitate contact between species that usually have little or no prior interaction, allowing pathogens to cross the species barrier. So the Nipah virus emerged from a large intensive pig farm in Malaysia in 1997, and studies suggest that Nipah virus spilled over to pigs from infected fruit beds, searching for food in cultivated fruit orchards as adjacent to the pig farm. And then infected pigs were then sold to other commercial pig farms in the south, resulting in the 1998-1999 outbreak in pigs and piggery workers. So we believe that if we really want to prevent a pandemic or a future pandemic, we really need to understand the mechanisms better between habitat change and emergence of zoonotic diseases. And unfortunately, I mean, we usually respond when we have a crisis, and that's by far too late, and we often miss baselines. So it's really important that we establish baseline data of the presence of a range of viruses, but we also sample in areas which are still pristine, but they are gazetted for development, and that we basically monitor that entire development process to better understand the correlation between habitat change and emergence and spread of zoonotic diseases. So we are very grateful to GIZ and the International Alliance Against Health Risks in Wildlife Trade, because they supported a project we are implementing with the Wildlife Conservation Society in the Republic of Congo. And why Republic of Congo? Well, the Republic of Congo had already been at the front line of a number of disease emergences, especially linked to Ebola. But there's also a system in place in many parts in northern Congo, where there's already a basic wildlife and human health monitoring system in place. So we partnered with WCS to first support the capacity in country, and that's by the use of the next generation sequencing tools, and more specifically, a portable real-time DNA and RNA sequencing device called Minlon. So samples were collected from incidental wildlife carcasses and bats, and WCS screened for viral families associated with zoonotic epidemics such as SARS-like coronaviruses, filoviruses, that's the family of Ebola and Marburg, Nipah viruses, And then finally, WCS uses an open source risk assessment platform to evaluate the risk profile of the viruses identified in the samples. And here you see some photos from the fieldwork. And actually, WCS collected oral, nasal, urogenital, rectal swabs and blood samples from more than 450 birds at 10 different hunting sites, supplying beds for markets in Brazzaville, that's the capital, and Veso, which is closer to the northern part of the country. And yeah, more than 66% of those samples contained corona virus RNA. WCS also found evidence of viruses of the Filoviridae family and the Paramyxoviridae family. And what does it mean? Obviously, bad populations are carriers of zoonotic diseases with a considerable risk of spillover. Also, more than 400 serum samples from bats were screened, and a whole range of different viruses were identified. So the Ghana virus, the Nipah virus, Mojang virus, so Suka virus, and Bombali virus. That's basically the Ebola virus from Sierra Leone. And it actually raises questions because so how did the Ebola virus and that strain from Sierra Leone made it to Central Africa? Or another question, so the Suga virus, there was only one case of human infection in South Sudan, northern Uganda. How did that virus make it to Central Africa? So lots of open questions, and we're looking forward to get a more precise estimation of the spillover probability. This is right now going on, and we expect more results in the coming weeks. And yeah, just in line of what I said before, there's a lot we have to learn, and wildlife and human health monitoring is really important. Just a few months ago, Gogarten and co-authors published an article, and the title is "An Ounce of Prevention is Better: Monitoring Wildlife Health as a Tool for Pandemic Prevention." And I just wanted to close that aspect of my talk and say, I think it's a really innovative project because in very, very few cases, we have the opportunity to monitor human and wildlife health basically along a development gradient. So from the beginning and hopefully to the end. And I really hope, I mean, all these diseases are scary. There's no nice disease in here, but hopefully we will understand the mechanics or the mechanism of disease transmission better and can take and then can take informed decisions. So the second part of my talk is more, what does it really mean? And how can we include this into development planning? Habitat alteration is very complex and there are many different forms, and I just show you a few. In the background, you see a large-scale palm oil plantation. That photo is from Saba. We have charcoal production. There's a photo on the right top. That's from northeastern DR Congo. We have logging activities. That photo is from Cote d'Ivoire. Charcoal production, bottom left, is also from Cote d'Ivoire. We have small-scale gold mining in the DR Congo. We have slash and burn agriculture in many countries. That photo is from the Cote d'Ivoire. So there are many, many different forms of habitat alteration. And Lawrence et al., and that's already a few years back in 2015, they published a paper estimating the environmental cost of Africa's massive development corridors. And what you see here, that map identifies the sub-Saharan development corridors, and some of these corridors potentially have huge implications because we never had basically an easy access to the Central African forest from both the north and the south. So that road, which will extend from Brazzaville up to Central African Republic, and it's already in here in blue, that will be the first time that the forest is easily accessible to ethnic groups coming from the Sahel. and from north of the forest, for basically the forested areas in Africa, and it has to be managed. And I'll give you a few more examples. So the apes database, an initiative of the IUCN Primate Specialist Group section on great apes, is a database which has a lot of monitoring information on great apes and great ape habitats. And I just took it out from a dashboard in the Apes Wiki, that's how it's called, and looked where do we have mining activities in great ape countries, and you see there's a lot of overlap. And now looking into now basically looking into the current political context where Europe and also parts of Northern America and other parts of the world try to move towards a green economy that also needs resources. And a lot of those resources are found in Africa, so they have to come from somewhere. But often we lack a framework for proper planning. And yeah, basically, because of this, we decided to publish an article on the threat of mining to African great apes. So we looked at that overlap, but we also looked where most of the pressure is and made a number of recommendations to mitigate the impact of mining on great ape populations and habitats. So equally, in the apes wiki, you find information on the overlap between hunting and great ape populations, and agriculture and great ape populations, and logging and great ape populations too. And a big discussion in GRASS was that looking at our Southeast Asia, where a lot has been converted into palm oil plantations, is that going to be the same scenario in Africa? So where is our deforestation coming from? Is it large-scale agriculture? Is it small-scale agriculture? Is it all palm oil? Is it something else? So with multiple grants from GRASP and also from the JEF, Congo Basin Impact Program, we supported a study done by the IUCN Palm Oil Specialist Group, and they identified where most of the deforestation in African great ape range states comes from, and it's a big concern is small scale and slash and burn agriculture, and a lot of the commercial agriculture is not necessarily linked to palm oil. There are many other commodities which have caused deforestation. But what does that mean? So again, I come back to the Alliance and GRZ for the second portion of our grant, and we felt that we really have to include health considerations in development planning. And so this project has a little history, because a few years ago, the task force under the IUCN, which is called ARRC, Avoid, Reduce, Restore, Conserve. So it's a task force which looks at the impact of extractive industries on great and smaller apes. So that task force and GRASP have advised IFC on the revision of their performance standard 6 on biodiversity. So IFC stands for International Finance Corporation and is basically the private sector arm of the World Bank. So when companies seek funding for their operations or for their development activities, they go to the IFC, and this IFC has to look at the performance standards, and based on those and an assessment, they agree or do not agree to fund those activities. So with the revision of performance standard 6 biodiversity, we were quite successful, because we included great apes in that performance standards. And that sounds trivial, but it actually has huge implications for the industry. So when now the private sector seeks funding and the operations could potentially have a negative impact on great apes and great habitat, they are obliged to go to the IUCN Primate Specialist Group section on great apes and ask for advice on environmental impact assessments. And actually, we have been able to mitigate impact in a number of cases, and some projects also, based on our advice, did not receive funding. But now the health indicators, and that's a totally different story. So far, IFC has only looked into the more proximate impacts of development activities on the health side. And when I mean proximate, it's more toxic waste from mining activities, pollution. But they've never looked into the risk of disease transmission. And so we partnered with the ARC task force, and they looked at 3 performance standards specifically. That's performance standard 2 on labor, performance standard 4 on communities, and performance standard 6 on biodiversity. And these are the key findings. So first, there's a lot of mention in performance standards of the disease transmission risk to wildlife associated with the project's direct, indirect, or cumulative impacts. Also, there are weaknesses in performance standard 2, that's labor, and performance standard 4, that's communities, in acknowledging the interconnectedness between workers, local communities, animals, and I include livestock and wildlife, and the wider public health. Best practice standards should adopt a One Health approach for identifying and assessing risks and project impacts. And finally, practice standards should also require the development of a disease or health management, action and monitoring plan, which should also include an emergency response plan. So there are a number of documents which are already quite useful in that context. One is the best practice guidelines for health monitoring and disease control in grade A populations. So that's an existing document developed by the primate specialist group and section on great apes. But now with that funding from the Alliance, we have been able to produce a volume 2, which will be published in the coming weeks. Also, with that funding, we produced basically an infographic on great ape disease risk mitigation, and that's really targeting the workers in industrial development projects to make them understand what the risks are. And I also want to mention, because we are just out of a pandemic and we have short memories, we tend to forget. But I mean, the pandemic was real. And at the beginning of the pandemic, also the primate specialist group issued a statement on great apes, COVID-19 and SARS-CoV-2, basically giving best practice guidelines. So yeah, one of the recommendations of the ARC task force for IFC, but also, of course, for other lending banks and the private sector, was to implement a One Health approach. And One Health basically looks into that connection between humans and livestock, humans and peri-domestic wildlife, also humans and wildlife directly. So it's all connected. And unfortunately, very often the environmental dimension of this has not been well represented. So now we have a really nice definition of One Health, and that was done in 2021 by the One Health high-level expert panel. And I just cite from them: One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. And yeah, at the end of last year, another really interesting article came out, and it's trying to link basically the climate crisis, the biodiversity loss, and health, and goes back to my initial opening remarks. It's time to treat the climate and nature crisis as one indivisible global health emergency. So I want to come to 3 main conclusions. The first is more trivial. Human activities promote the emergence of zoonotic infections. But second, we really need to strengthen capacity to better understand disease emergence. And I think here is where really the ecological knowledge comes into place, and we have to strengthen the environmental angle of One Health. And third, and that's a little bit provocative, include health considerations in development planning. I mean, reality is we're often already happy if there's a proper environmental and social impact assessment in place when there are proposals or the governments are faced with proposals for big land conversions. And often there's no framework, or there's a framework, it's not properly respected. But I think we have to go further. What we actually need is environmental, social, and health impact assessments. I understand that this is a long way, but I believe that our work in liaising with the IFC, and it's a well-respected landing bank, and often IFC standards have been copied by other landing banks, could be an entry point. And the ARC task force tries to influence performance standards in other lending banks too, the European Investment Bank, and sometimes also directly in private sector companies. At the end, I think we're not that different from our closest relatives, in this case the gorillas. Look, the gorilla babies protect themselves with leaves on their heads against a heavy thunderstorm, and the human children don't do anything else. So we're not that different, but I think we need to find a way to reconcile that we are not losing biodiversity, we are not losing our closest relatives, but we also maintain our own health. So with that, back to you, and Christine, I'm happy to answer questions. I hope I have respected the time.
Yes, perfect timing. Thank you so much. And what a beautiful little ending. That's very, very nice. Thank you so much also for all the insights. A lot of good things to think about. And yes, let's take some questions maybe. Let's dive right in. We do have already, I think, 2 questions in the chat, but I also want to give the chance for the people to raise their hand and then unmute themselves. So we have one question from Manon. If you would like to unmute yourself and ask your question directly, feel free to do so. Otherwise, I can also just read it out maybe. Because she's curious to know about the open source platform that the WCS was using during the Congo project.
Do you want me to respond directly, or do you want to collect a number of questions?
Well, maybe to this one you can also just respond now, and then
yeah, it's easy. It's one name, spillover. It's called spillover.
Okay. Yes. All right. I think we have another actually. Oh yeah, is there more information that people like? Do you maybe have like a link or something that people can find more information on spillover? I think there was another follow-up question on this that we can maybe just share. Maybe we can just share it afterwards as well. Maybe on that note, are environmental health indicators been developed for spillover prevention as it was presented with wildlife? This is a question from Manon Lunas. I don't know if you maybe want to elaborate on this. If you're here, please unmute yourself.
Yes, I'm here. Thank you. Yeah, thank you for the great talk. It was very interesting, and we learned a lot. So yes, I was wondering on the type of indicators in terms of environmental health, such as, I don't know, forest coverage, water quality, or things like proxy or indicators that could be used to mitigate the risk and anticipate zoonotic disease emergence.
Yeah, I actually cannot answer that question yet because the analysis is going on, and I haven't received the results. It will be coming in within the next probably 4 weeks, and then I can explain better.
Okay, so I look forward to hear from you on that later. Thank you so much.
Yeah, and I also believe, I mean, the results of that study will go into a GIZ report on the key findings of the different projects the Alliance has been supporting. So hopefully within the next couple of months, we can finalize our own component, but also can contribute to some kind of a technical paper.
Thank you.
Yes. Okay, thank you. Nia Vora, you want to unmute yourself and ask your question?
Yes, thank you. What a fantastic presentation. I had a question, in the beginning of the presentation, I think 4 different explanations were given for why spillovers happen as humans encroach on natural habitats. And the first one was about the loss of specialist species and the ongoing survival of generalist species. And then the second reason was about the dilution effect, if I recall correctly. To me, I guess I understand those as 2 similar phenomena, that the loss of specialist species is provides support for the dilution effect as a theory to explain the emergence of pathogens. Or but the way I understood the presentation is that you were saying that maybe these are 2 different phenomena. Could you explain a little bit further? Thank you.
No, one is not excluding the other. I was just trying to group different research findings and find a structure and try to explain that there's not always a direct link between habitat destruction, we lose species, and we have new diseases. It's a bit more complex. It can be a dilution effect. We might end up with more fragmentation and having co-evolutionary effects. In many cases, yes, if it's really a monoculture and very few species are left, then it might really be that it's a generalist and then a higher risk of disease emergence. But one is not necessarily excluding the other.
Thank you. That's great.
I mean, my motivation for going to the detail was really, if we want to prevent the pandemic, we have to understand the mechanisms better. And in many cases, we simply have too little knowledge because we don't have the baselines, or we only monitor when the disaster has struck, but we don't monitor along that entire gradient. And I mean, it might start that we cut down a forest, but then out of a sudden we move goods and they come from far away. We move workers, they might also come from far away. We encourage settlements. So it's very complex. And I think often when we approve these big projects, we're not looking to the details.
Yes. Thank you for elaborating on that. Are there any other questions? Don't be shy. You can raise your hand and unmute yourself. Or comments. Kim, go for it.
Hi. Hey, Johannes, thank you so much for your excellent presentation. It was fantastic to see that. Could you maybe speak a little bit more specifically about the development and what that means or could mean for wildlife trade? I know you're familiar with the research on how building roads can lead to increased wildlife trade and what that might mean in the context of disease emergence. So basically making the link to the International Alliance or what we work on, maybe just a little more explicit, that'd be fantastic. Thank you.
Yeah, it's a complex question.
I know. Of course.
In some cases, companies who operate in those areas and do development, they do have to follow certain protocols. So, for example, when you look at FSC concessions in the Republic of Congo, they actually subcontracted WWF to do the monitoring, but also to make sure that there's no trade in wildlife. When we go at the higher level, when it's really about approving big projects, and we go at the level of the IFC, you have seen that is not specifically mentioned. Yes, of course, the IFC also has to make sure that protected species are not consumed, and has to make sure that whatever happens is compliant with national or international law. But the more complex relationships, the risk of disease transmission is not featured. And that's definitely an entry point we want to take to once specific performance standards are open again for revision, that we can provide commands via the ARC task force. and include some health or better health relevant indicators. Now, wildlife trade is, of course, not all the same, and I have to make that distinction. I mean, we also know, especially in that area where we were working in northern Congo, we have a significant proportion of indigenous people there, and this is their only source of protein. And telling them that you cannot eat your wild meat anymore is a social problem. But also there's some early findings. I'm not sure whether it has been published yet, but I know from some colleagues that there seems to be evidence that the indigenous people in Central Africa have a certain level of immunity against some of those viruses, while migrant workers or people coming from far don't have it. So it's again quite complex. And then third, I mean, that's a more general comment on wildlife trade. I think for us, and I'm also representing UNEP here, it's important that that trade is legal, is regulated, it's sustainable, and it's also safe. Because I mean, obviously, some species can be traded by natural law and also by international law. But of course, in many cases, it might even be sustainable, it might be legal, but there's still a disease risk. So it's a very complex relationship. You can have legal trade, it's unsustainable and it's unsafe. You often have illegal trade, it's rarely sustainable. It's often a high risk of disease transmission, but I think we have to be very clear what specific aspect of it we are really addressing. And in some cases, I mean, when that pandemic came, it doesn't help when we tell the indigenous people you cannot eat wild meat anymore, and it's an important part of their diet. What we can do and what has been done before, Ebola has been a high risk, and people have been informed, I mean, including the indigenous people, that when they find carcasses of great apes in the forest, there's a high risk that they could infect themselves with Ebola. And that was the origin of the Ebola monitoring program. So these things can be done, and then there's a clear reason. But I would be hesitant to say that indigenous people cannot consume bushmeat or wild meat.
Thank you, Johannes. I think it's a really important point. What you mentioned also, that there are some indications that local populations may have at least partial immunity to some of the microorganisms with which they live or that are in the wildlife, and which I think might be something that's overlooked when looking at the urban trade, which not only sometimes empties the forest and leaves people who depend on that protein without it, but also increases the risk because it gets into urban populations that may not have the same level of immunity, plus the higher population density, plus higher mobility. So yeah, I think that's a really important point. So thank you for elaborating on that.
Yeah. I mean, there's all just coming back to that point. There are also huge differences. I mean, when you look at some of the big markets in Asia or also in Central Africa, of course, you find all in one market. So there's obviously a high risk, but we also have a form of legal wildlife trade in many of the Southern African countries, and it's regulated, it's controlled, it's a significant contribution to community livelihoods. When you look at Namibia, where the communities own the land and manage the animals, when we would come and say, "Oh, you can't do that anymore," we actually undermine their business model. So it's very complex. But of course, also it's a different habitat where maybe the risk of disease transmission is a little bit less than a market in Kinshasa, for example.
All right. Thank you. Kim, Just go for it.
Just one quick follow-up question, and you might have mentioned it, Johannes, and maybe it's obvious, but so you're focusing very much on Central Africa, also with the task force and your discussions. But basically, what you're working on with the performance standards, that will be applicable in other regions of the world too, right? Once you have developed the standards.
So yes, absolutely. So the standards are global, and actually the task force has been advising on projects in Asia too. We have another grant from the Jeff Congo Basin Impact Program, and with that funding, the task force has been training Central African experts in environmental impact assessments, and that was really practical training. So they took out the experts to sites where they could actually learn how to assess the impact. So they were taken to a hydro power project in Gabon. So really interesting. They also did something similar in West Africa, but that was not our funding. And there's actually a request from Malaysia, where there's a way to find funding to do similar training in Sarawak. So yeah, the standards are global, and we try to do the same in Asia too. And of course, I mean, there are development needs everywhere, and there's pressure on biodiversity everywhere. So it has to be global.
Yeah, for sure. Thanks for the little discussion. We still have 4 minutes, so if there are still more questions, then now's your chance to unmute yourself and take up some space or use the chat as well. I think it's a very complex topic, so I don't know, maybe people need to digest it a little bit and process what we've just taken in. At least for me, I also feel like there's a lot of aspects that are very interesting, especially also if you talk about the global scaling, and then once you kind of assess and you have the standards on, okay, what's the next step afterwards, how can you maybe do it differently so that you minimize the risk, but still, I guess, then go through with development projects. So yeah, if there's anything else, someone else would like to say something, again, could also be a comment, or if you would like to, I don't know, receive more information on a specific point, feel free. I don't know, Johannes, if there's anything that you would like to still add. We still have a few minutes, otherwise.
Yeah, basically only that, I mean, the Alliance is looking at one aspect, and that's really the wildlife trade. But of course, wildlife trade is embedded in a larger socio-economic and environmental context, and it's all correlated, and it's complex.
Yeah.
And I mean, the reality is, of course, I mean, when you only talk to a disease expert, I mean, then it's the message very clear. We have to reduce contact to animals, whether domestic or wildlife. That's where a lot of risk is. But does it mean we don't want to do mountain gorilla tourism anymore? It's a really complex debate, and we have again, I mean, we have to look at the risk and then come up with pragmatic decisions in terms of great ape tourism. There are best practice guidelines to minimize the risk, but of course there's still a risk. And the risk is also that habituated gorillas tend to go out of the forest and go into the farms and then have contact with humans. And the same if if I take Namibia again, yes, when you have sustainable use, there's a risk. On the other hand, it provides the livelihoods of the people. If they don't have it, maybe there's an even higher disease risk because they cannot pay for medical support. I mean, it's really complex, and there's no easy answer, but I think we can work on standards, and we can hopefully make sure that those standards are applied. And we started with IFC, and hopefully they can look into this, and we can reach out to other landing banks too.
Thank you, Johannes. Just very quickly, wanted to thank you for also making a case for the great ape health and maybe representative for wildlife health, and by that pointing out that disease transmission is not unidirectional; it actually goes into two and more directions. So thank you for making that explicit as well. It's fantastic.
Yes, thank you. Yeah, I always find it fascinating if you know, like have those little case studies and then you embed them in the broader picture and you see how complex everything is. And also, as you said, how connected everything is, and you cannot look at one thing with one perspective. But there's also the beauty of having an expert network, because I feel like all of this things come together slowly, you know, and we're working towards improving the bigger picture, let's say. So yes, thank you so much for taking the time to present on this. And I hope we've all learned something. And we're gonna, you know, maybe think about one or two things a little bit more, given how complex this all is. And yes, thank you also everyone for being here. If there are no further questions, which I can't see, otherwise, last chance right now. But otherwise, I would just close this expert talk and say thank you, Dr. Johannes Refisch. It was a pleasure having you on behalf of the whole Secretariat. And yeah, you will find the recording online on the Alliance's website. We'll send out more information on further events of the Alliance. And Johannes, please, you have the last word.
No, I just thank you for the opportunity to present. I mean, it's a pleasure. It's great. And please share. And if there are questions, just forward them to me.
Yes, thank you. Of course, yeah. Just reach out to the Alliance Secretariat, and then we can also connect you. And yes, thank you so much. Enjoy the rest of your evening, day, morning, and hope to see you next time. And thank you so much, Johannes, again.
Thank you so much. Bye-bye.
Bye.
Thank you. Bye.